It is a silent killer which often goes undetected until it's way too late. But now a new blood test could save Queensland patients struck down with sepsis, especially children. The breakthrough means just 1 hour could be the difference between life and death.
When it comes to combating sepsis, time is of the essence.
If we can identify, recognise and treat sepsis sooner in children, we can save lives.
Current tests are no match for the life-threatening condition, which occurs when the body's response to an infection damages its own tissues and organs. Confirming a sepsis diagnosis involves growing blood cultures in a lab, and the whole process can take up to 72 hours. By then, it's often too late.
Sepsis is one of the leading causes of preventable harm in children and unfortunately does cause death in children.
This little device could change it all, promising to return a result in 1 hour. With a small blood sample, it can detect the specific immune response the body generates when septic, and it's easy to use.
And it takes about 2 minutes' time to actually set up the test, and then they just press a button, and then within an hour they have an answer.
An earlier version of the test by biotech firm Immune Express is already being used in Europe and the US. Clinical trials will begin in Australia within months, thanks to funding from the Children's Hospital Foundation.
This could save lives. We know that delays to treatment of sepsis in children increases the mortality, it increases the probability of a poor outcome.
The final hurdle involves getting the all-clear from Australian regulators.
And once we have regulatory clearance through the TGA in Australia, we would be actually selling it in Australia, and we expect that to be mid next year.
Brendan Savage for 10 News First.